affordable copay. There's usually significant delay in my patient getting her drug to relieve her condition. There's also a delay in the treatment of additional patients while I am wasting administrative time working through the quagmire caused by the multiple different prior authorization forms and their complicated formats. The prior authorization for a drug thought too expensive for a health plan's formulary is a necessary part of serving the California patients in a fiscally responsible manner. We understand that. However, this process needs to be made as simple and as expedient as possible to get the most medically appropriate therapy to the patients and to maximize the time that the doctors of California spend actively caring for our patients.
Further witnesses in support?
Yes, thank you. Good afternoon, members of the committee, Dr. Hernandez. I'm Liz Helms, the chair of the California Chronic Care Coalition. The Chronic Care Coalition is represents more than 16 million people in California with chronic conditions and includes healthcare providers, nonprofit patient advocacy organizations, and social policy groups. In representing over 16 million people with chronic conditions, you can imagine the amount of medications that these people are taking and what a barrage of prior authorizations that face them when they're trying to get the medicine that they need in a timely manner. The Coalition's mission is to ensure that Californians with chronic conditions can access comprehensive, affordable, quality, and timely health care that includes access to prescription drugs, and which includes life-saving medications for many of the people we represent. Many of these medications are not on health plans formularies and therefore require prior authorization. I decided that I would start to poll some of the members of our organization and see what kind of a problem there was with this going on. And I didn't have to go very far because the very first person that I talked to was one of our members who's had 2 liver transplants, and medicine is very important to him. He told me of the time that he needed to get one of his drugs, which was Procrit, which is a very important medication for him to take, and that there was a 2-week delay, which put him to bed for those 2 weeks until it was the prior authorization came through. And I know there's many, many more stories like this that we can present to you, but at a later date. And because of this bill, the streamlining of prior authorization process and patient care would be immeasurably improved, and it would be at a lower cost for everybody. Adherence and compliance are huge. We spend a great deal of money on non-adherence and costly hospitalizations for people that are not taking their medicines properly. This will help solve a lot of that problem, and therefore we're here to support this bill. Thank you very much.
Thank you. Further witnesses in support?
Thank you, Mr. Chair and members. Teresa Stark with the California Medical Association. And at a time when we are all concerned with controlling healthcare costs in the system, CMA believes that this bill is a reasonable and sensible approach to limit administrative costs while also meeting the needs of patients. We think this bill is a win-win for providers, for the health insurers, and most importantly for the patients, and we urge your support.
Thank you. Further witnesses in support?
Thank you, Mr. Chair. Members, my name is Fred Noetwer. I'm representing PhRMA today and the medical oncologists in California, the cancer physicians, and I want to lend our support for this bill, and in particular just let the committee know the delays in getting treatment authorizations and prior authorizations, particularly on medicines, is a growing concern in the oncology community, so we would urge your aye vote.
Further witnesses in support?
Don Shinsky on behalf of the California Academy of Family Physicians in support. Thank you.
Thank you.
Bill Barcelona with CAPG. We're both payers and providers in this process. We're in full support of the bill.
Thank you. Any witnesses in opposition?
Thank you, Mr. Chair and members. Nick Luizos with the California Association of Health Plans. We're actually an oppose unless amended. That's our initial position on this bill. I would like to say the author and his staff and the committee have been very engaged with us in a constructive dialogue, and we certainly are appreciative of that. And we should also add that recent amendments to the bill do address some of the issues that we've outlined in our oppose unless amended letter. But there are still some outstanding issues, primarily related to the timelines that the chair addressed in his opening testimony. The only thing that I will add is that we do believe that prior authorization is very important. It is one tool to ensure that medical and cost management work in tandem in delivering appropriate care. And we know that it is not the intent of the author of this bill, but one of our overall concerns with the bill is that it would inadvertently put a process into place that compels coverage of expensive drugs when there are generic or cheaper alternatives on the market. But we believe that by continuing a constructive dialogue and working together, we can get to a place where we can obtain efficiencies but still protect the integrity of our formularies. Thank you.
Thank you. I just had a quick question for you.
No, yes.
Sorry. Thanks. If the timeline's the real problem here, and as I look at it, I think this is a very important issue, and I commend the chairman for bringing this issue forward. What would be a desirable timeline for you? Because if you mentioned 48 hours, what would be your timeline?
Right. There's less concern about the specific number of days outlined in the bill. What we're asking for is some flexibility, however. There is a standard on the Medi-Cal side. There is a 24-hour standard for treatment authorization requests. However, it's based on business days, not actual days, so there's some flexibility there. If an authorization request shows up at like 11:59 on a Friday evening, there's some flexibility on the business day angle. We would also we also have concerns about a potential situation where a provider hasn't filled out the form completely, and there needs to be some follow-up with the provider. Would the 48-hour deemed approval of the prior authorization request still apply in those cases where we need further information if the form isn't filled out, or if there is no response to a follow-up call for information?
Thank you.
I'd like to address some of the concerns and kind of add them into my close, if you don't mind, Mr. Chair.
Yeah.
Or go ahead.
I think Senator Anderson had a question.
On some of these treatments in the delay, how do we reconcile if somebody's in a position where they need the medication are there circumstances in which we're waiting for an approval on medication that the person needs to be taking currently? For either one of you.
Well, I think the reason that, and I'm not sure this addresses the specific question, but I mean, the reason that health plans utilize different forms for different drugs, whether they're for an emergency or not, is because there's different clinical information that's required for different drugs. They feel, our plans feel that by having specific forms for different types of drugs, and not all plans do that. Some of them actually do have more standardized forms, but that by doing that, it makes the process more quick. By getting the right information up front, you don't get engaged in a back and forth between the plan and the provider on the specific type of diagnostic and clinical information that's needed to make the request.
Let me see if I can answer some of your questions, but let's first look at the form. It can be done. If you look at the federal level under Medicare Part D, the feds came in collaboration with a lot of the pharma industry as well as the insurance industry, and they came up with a standardized form. I understand that there's some concerns about the 48 hours, but I want to use an example of what's being done right now with a 24-hour authorization that they need to get it back, and that's through managed medical care through Medi-Cal here in the state of California under DHCHS. So it can be done, and I'm committed to continue to work with the opposition, but I think there needs to be some resolution on, number one, the form, the timeline, and to address your concerns with regard to someone who has a chronic disease or a disease that is of importance that needs to have medication in a very, very immediate manner.
Any other questions? On that note, Mr. Chairman, I'm prepared to vote for this bill today, but under the I would like to see us working, the chairman working with the opposition, particularly on the timeline business week versus days as the testimony came forward, 4:55 on a Friday afternoon, things like that. But I know the chairman's always committed to doing that.
No, definitely. I'm committed to making sure that this works. It's reasonable. I understand that somebody comes in Friday afternoon, the form may not be filled out right, but there also needs to be some consensus that there needs to be some immediacy as far as making sure that it gets done and that patients get their medications. So I respectfully ask for your aye vote, Mr. Chairman.
Okay. Well, the bill's moved by Senator De Leon, and Secretary, please call the roll.
The motion is due pass to appropriations. Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Aye. Alquist, aye. Anderson? Aye. Anderson, aye. Blakesley? De Leon? DeSaulnier. DeSaulnier, aye. Rubio. Rubio, aye. Wolk.
Is there somebody missing?
De Leon, aye.
So that's everyone, right? That bill has 7-0. It passes. Everyone that's voted is here. We'll go ahead and dispense with that item. We're going to go ahead and lift the call. We've got all of our members here. Let's start off with item number 1, SB 177. Call the absent members. That vote is currently 4-0.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. DeSaulnier. Aye. DeSaulnier, aye. Wolk.
We have 7-0. That measure is out. We're going to move on to item number 3, SB 359. The current vote is 5-0. Secretary, call the absent members.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. Wolk.
That has 7-0. That measure passes. Move on to item number 4, SB 411, Price. We currently have 3-2. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. Wolk.
We have 5-2. That measure passes. Item number 5, SB 422, Wright. The current vote is 5-0. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. Wolk.
That is 7-0. The measure is out. Item number 6, SB 422, Calderon. 442, Calderon. The current vote is 4-1. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. Wolk.
That vote is 6-1. The measure is out. We're going to now move on to item number 10. Item number 11, item SB 844. The current vote count is 6-0. Call the absent members.
Senator Blakesley. De Leon. Aye. De Leon, aye. Wolk.
That count is 7-0. The measure is out. It's consent. We have the consent calendar. Anybody like to add on? Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. De Leon. Aye. De Leon, aye. Wolk.
That measure is 7-0. It's out. That concludes the business for today. The meeting shall be adjourned.